questions, and I will be recording your responses. And after that, we shall just take a walk around the facility to see some of the things you have shared.
Community needs assessment. It has 8 categories in different departments in the hospital. Now we are starting with hospital leadership, medical superintendent, stroke administrator. A. What is the current burden of hernia cases seen annually at the hospital?
But quite a number. I can't give you the exact number, but it's quite a lot. And the biggest percentage can't afford this.
With the stitch, we have some percentage of reoccurrence for the hernia. But we all appreciate that when we use the mesh tends to induce inflammatory changes, and then there is fibrosis and strong scar formation that reduces the chances of recurrence.
Do you have access to commercial meshes? If not, what are the alternative used? Commercial meshes.
For the commercial meshes, normally send patients to Kampala. The mesh is going to cost you 400,000. They'll be like, you're being too expensive. Yeah. So you tell them to remove the bias, go for yourself and you see.
So the truth is, often the mesh is not so easy to get. It's not accessible, and sometimes expensive. Even when it is accessible, you find facilities, it's easy to hard to find people with the skills. So this project aims at empowering facilities to make their own mesh from the net or from polyethylene. So you make your own nets, do the hernia surgeries, and then be able to save lives. The question will come, how do we start, how it's done? That is part of the project. How do we do this? How do we get the skills? Where do we get the equipment? Has it ever been done? We have the literature. When we started this project, we wrote to National Government Authority, who gave the certificate of importation and gave the go-ahead. And we are currently engaging the Director of General Services and Ministry of Health to get on board.
Handle them very well. I know very soon the technical people will be coming, and they will not come with us. We just tell them, go to St. Francis, go to where, go to where. So let us make sure we are up to date, you know? The theater, the work, the things we talked about, then we don't even remember them after here.
So at the end of the project, if all goes well, we know that St. Francis will be able to make its own mesh and give other facilities. And in between there, we shall be able to have surgical teams coming on board, work on people and exchange their skills. Because Hernia International, international charity organization, has close to 30 surgical teams of surgeons that move around the world at their own expenses, extending, giving services to people. And some surgical teams, they don't only do hernias, but they do other procedures. So that's what we basically look at. That's what we